It is time for our weekly checkup with Santa Barbara County Public Health on the latest on the pandemic. And Dr. Henning Ansorg back with us today. Dr. Ansorg, hi, nice to see you again.
Thanks. Good to be here.
All right, we're hearing a lot of talk about boosters. Also seems like there's not a huge rush to go get them. What are we seeing when it comes to booster doses, and are people locally heading out to get those when they're eligible?
Yes, they are. So far, the boosters are only for people who had the Pfizer vaccine initially, and it's recommended for everybody over 65. Now, this will change when the CDC will come out today and, endorse the FDA-approved for emergency use boosters for Moderna and Johnson & Johnson. So that will change the landscape. So we're expecting, of course, more people to show up at the pharmacy or the local doctors to want a booster.
And how does it work kind of coordinating with pharmacies or a doctor's office to get these shots out? Obviously, it's a lot harder than having a clinic that's set up, and you got to kind of manage how these things are sent to certain places. How is that working with the county?
Well, the pharmacies have been astoundingly effective in getting people vaccinated locally and nationally, actually. And so we're relying heavily on them, as well as on big clinics that have the vaccine and, are very effective in giving it to their people. Public Health Department will not have a large so-called vaccination pods, but will concentrate on people who cannot get to their pharmacy or doctor, like homebound people, people in facilities where they cannot move easily, or bedbound people. So that's what we are doing. We have teams going there and giving those vaccines in addition to the flu vaccine.
Yeah, very important. We've seen the clinics actually going on this week with the flu vaccine. I know we've had our reporters out there. How important is it to go get that flu shot, especially this year?
I would strongly recommend to get the flu shot, especially for people over 65, and it's perfectly safe to get the flu shot and the booster for COVID at the same time. So you can save yourself a trip and just get them both.
Let's talk about vaccines for kids that aren't yet eligible, 5 to 11 years old. When is this going to happen? I know we keep talking about it week after week, and we're getting closer to those November dates when they say this may be approved. A lot of parents are waiting, though, and some that are even skeptical of, if they're going to get their kid vaccinated, waiting for more information.
Yeah, I mean, fortunately now we really have a date when the FDA is discussing this, and that's next Tuesday and Wednesday. And the following week, so the first week in November, the CDC will come up with a recommendation depending on what the FDA says. But, all the signs really hint towards that it's going to be approved. The vaccines have been very safe in the studies, especially in the younger kids. Now, it's very important because we have seen in California and nationwide a significant increase in children being hospitalized for COVID. And that is very concerning, obviously. And that was not the case previously, but it is, we have 10% of our population is younger than 10 or 11. So it's a big chunk in the community. And we are really, really grateful that this vaccine will come out. It's a smaller dose, appropriate to the body weight, and it so far looks very promising. So I encourage all parents to get their kids in as soon as it becomes available.
It makes sense that a kid would get a smaller dose, but Moderna's booster, that if we go back to boosters for a second, it is also less than the original dose. Can you explain why?
Yes, of course. The Pfizer and the Moderna vaccine have the same underlying, mRNA, but the Moderna dose has 100 micrograms per dose, and the Pfizer for adults has 30 micrograms per dose. So that's why the FDA said the booster for Moderna should be half the original dose, and that's the reasoning behind it.
Going back to kids for a second, we'll get you out of here on Halloween, which is coming up just a little more than a week away. Obviously, a lot of people are looking forward to it this year, thinking that it's maybe in a better situation than we were last time. But who knows with the pandemic going on. What do you want people to know? Obviously, they're going to go trick-or-treating. What should they know from a healthcare professional's point of view?
Well, fortunately, kids are back in school, so kids are going around. So I don't see any reason why kids shouldn't go trick and treating. Honestly, it's outdoors. The activity is much safer. So every outdoor activity is safer. Obviously, just like in schools, if it's indoor or doing transportation with multiple kids, it's safer to wear a mask. Other than that, I think it's going to be more fun than last year for sure, and everybody is really very knowledgeable now. How to protect themselves and others. So. Because the trick and treating can be outdoors with our good weather here, I think we are in a good shape.
Great, and I know a lot of families, little kids, happy to hear that for sure. Dr. Henning
Yeah,
Ansberg from Santa Barbara County Public Health, thanks so much for joining us.
of course, my pleasure.